गया start?
Yes, sir.
ठीक है जी. Today we'll describe this case of primary infertility of 6 years with PCOD. She reported to us as infertility of 6 years with chronic PID symptoms. On ultrasound, we could see there was significant fluid in POD. On ultrasound, we could see there was significant fluid in POD and right ovarian fossa. Bilateral ovaries were polycystic. Okay. Her AMH was in 2018 was 7.88. So we did quantiferon gold test, and that turned out to be positive. She had symptoms of chronic PID, and there was chronic endometritis on 3D 4D ultrasound with quantiferon gold means IGRA based test positive, fluid in POD on ultrasonography, and prolonged infertility. All these were pointing towards genital tuberculosis. She was started ATT empirically. She was referred to chest diseases hospital for starting ATT empirically. And ATT was TB dawa beta start Panda 15th January she started ATT, and we did her scan on 12th of March 2023. Patient showed drastic improvement in symptoms of PID after ATT intake, and there was no fluid in POD. So today we'll again check her. Today is around 16th of July. See, this is uterus. Let us check whether there are any features of chronic endometritis on 3D 4D ultrasound. Let us see. So secretory endometrium. So as we can see, there are no such features of chronic endometritis. This is 3D 4D ultrasound. Slightly in the left corner part there are features of these are the features of chronic endometritis. Left lateral wall normal, right lateral wall normal, and right cornal part and frontal part is normal. So let us see whether there are features of any. No, there are not any features of chronic endometritis. This is for no, not at all. So 3D 4D ultrasound, we can see it is perfectly fine. The chronic endometritis features have disappeared, plus there is no free fluid in POD. This is the POD, and this is ovarian vessel. This is uterine vasculature. Okay, these are the uterine vasculature. Theek. So there are no features of chronic PID, chronic endometritis, along with significant fluid. There is no significant fluid in POD. Also, after starting ATT, her AMH has drastically improved. From 7 in 2018 it was 7.88, and today her AMH is 11.95 nanograms per ml. There was also free fluid in the right ovarian fossa around right para-ovarian space. So these are characteristic features of PCOD. Polycystic ovary, right polycystic ovary. Let us check whether there is any fluid. Still there is no. This is gut fluid. This is gut. No free fluid around right ovary. Let us see the left ovary. Left ovary is okay. Good. PCOD ovary. We were expecting that the AMH will rise because genital tuberculosis has but inhibitory effect on the ovaries. They produce toxins that is known as uphorotoxins that reduce the levels of AMH as well as increase the dose of gonadotropins needed for IVF stimulation. Again, we will check her on 3D 4D. So after the inhibitory effect of genital tuberculosis is gone, the AMH will improve. That is expected. So this is 3D 4D ultrasound. So perfectly normal uterine cavity. No evidence of any chronic endometritis now. So after finishing her ATT, we'll give her a try for at least 4 to 5 cycles. Then we'll again check. If she conceives good, then otherwise we can take her for IVF. Beta check out improvement I upon us in the vaccine pattern. Because takriban 50% kin zyada.
पंचा ज्यादा
50 ज्यादा आया
टोटली बना शोंगने
शोंगनस मस क्या दिक्कत छ यवان
मैं हेलन कर पेन
हाँ।
चिड़ असा पेन कमरस असा पेन
हां
मैं लायर अटैक टोटली
लायर ने लकुड़ पेशाब मौसी बार-बार खराब आसान ओसा आसान सी इंपॉर्टेंट वन ऑफ द इंपॉर्टेंट सिम्पटम्स ऑफ जेनिटोयूरिनरी ट्यूबरकुलोसिस रिकरेंट यूटीआई वंकस कसा फर्क छ बसान अराउंड 50-60% किन ज्यादा ठीक छ बेटा ओके जी थैंक